This show is brought to you by Rebirth Radio. Get ready. We're going live in 3, 2, 1.
Welcome to Voices of Virtue.
Every time you open your mouth to speak, something is supposed to happen.
Let our conversation always be wise and seasoned with salt, so that we may know how to answer others.
This is something special for you.
Voices of Virtue.
We're going to help them, let them know that they're not alone, not being afraid to speak, because you know what's hidden shall be exposed.
Voices of Virtue.
So keep your ears open, your eyes seeking, your tongue talking, because it will be powerful.
There is no such thing as failure. Failure is just life trying to move us in another direction.
Voices of Virtue.
Well, hello again. Here we are. Thank you for everyone that's tuning in to Voices of Virtue. We're elated to have you today, and this is none other than your very own TV show with Voices of Virtue, brought to you by Rebirth PR Media and Shadow World Radio. And today, along with us, we have our co-host with Rebirth, Ms. Simone Higginbotham. Let's give her some shout-out for Ms. Simone for being here with us today.
Good morning,
Yes,
good morning.
Yes. Good morning. Yes. Thank you, Ms. Simone. Thank you for joining us on today. And before we go any further, tell us a little bit about Simone, then we'll get back and talk a little bit about Cheryl, who Cheryl is. So Cheryl, we always hear you about, we want to hear a little bit about Cheryl, but first, we want to hear a little bit about Simone, and then we got this awesome guest speaker on today, Ms. Vikki Wilbon. But right now, Ms. Simone, tell us about Rebirth and Ms. Simone.
I am the owner and founder of Rebirth PR and Media. We do just many things for small businesses and small organizations. We do PR, we do media placement, we do press releases, social media management. Right now we're just getting into podcast production, so we do a lot of things. We are very active in the community. We're visible. So our mission is to be visible, but also who we represent for them to be visible also within their communities. That is very important.
Great. Thank you so much, Ms. Simone. We thank you for being so transparent for all the areas of help that you're giving out to everyone that has passion and purpose and trying to fulfill that. With all that being said, me, myself, Cheryl, I am that voice that wants to speak virtue into your lives, to come from way down in a little country area called McRae, Louisiana. We're out back in the 69 where the hippies came. That's stuff I never heard of it. But anyway, with that being said, guess what happened just yesterday? My 3-year-old grandson made 4 on yesterday, and we had an awesome time at 3. But I can tell you about at the age 2.5, he was doing his sign language, his alphabet and sign language. Speaks his numbers backwards from 30 on down. That was starting at about 2.5. He was doing all this. And he knows some of his numbers in Spanish. So we know sometimes we say like, oh, the technology is a negative to the kids. No. With him, it was a positive. He taught himself that by YouTube. So let's give a shout out to my 4-year-old grandbaby on yesterday and him using technology as a positive in his life. Yes. What we got to do is just monitor what they're using. And with all that being said, let's go on and on because we got an awesome speaker today. As I said before, Ms. Vikki Wilbon. And we want to let you all know that you are welcome to share this podcast, download it, invite friends, give us feedback, and even let us know what kind of topics that you want to hear about. Because guess what? We're here to sit back and have a conversation with you, just like you're sitting in your living room just talking to your friends, your comrades. That's what we're here for. Guess what? We're coming with truth, profound truth, being raw with it and yet being respectful. And so we just want to thank everyone else again for tuning in. Again, shout out to Rebirth, our co-host on today, and Shadow's World, and along with none other than Miss Vikki Wilbon. And before we get into it, we're going to talk about what's trending. Miss Simone, tell us what's trending right now.
Well, right now what's trending, what I found to be trending, of course, about the vaccine, and also the disparities of people receiving or getting educated about the vaccine, but also the COVID-19 testing in the African-American community. That's what's trending today, and it's really been trending for the last few days. I've saw on social media platforms. It's just a disparity in the African-American community when it comes to the COVID-19 testing and also COVID-19 receiving the vaccinations, but also our community, African-Americans trusting the vaccine. There's a lot of miseducation about the vaccine, so that's what's trending today.
Oh, great. Thank you. And to just add a little bit to that, with that training with the vaccine and what it has done, how it's affected, there's some positive, sometimes things happen, there's some good that come out of it. And we know that it did affect a lot of people with their rental resources. And with that training just on Friday, our governor, he announced the rental assistance that's going to start happening to help those that were affected in paying their rent. And with that being said, if you all can jot it down right now for more information, call 877-459-6555. And that is in coincidence, like Ms. Simone was saying, what's trending. And that is trending because I do know a lot of people need help with their rent, facing evictions, support that. And there's also a website, www.lastaterent.com. Let's do that again one more time, www.lastaterent.com. So as Ms. Simone said, the training with the vaccine, COVID-19, those that have been affected with the virus, also with income that could be of some help to others. So let's give a shout out to our governor, all the officials and staff that put that to part to help our citizens of our state of Louisiana. Okay, now are you ready? Are you ready? Miss Vikki Wilbon, will you please welcome her with us? And also, Miss Wilbon, please tell us about yourself. We do know that you are a registered nurse, owner and operator of Rosebud Healthcare and Training. Also, now this is what I love, y'all. This is what I say is real service, giving back. This is when you know someone has a heart. She's a founder and the president of Rosebud Incorporated, which is a 501c3 community service. So with that being said, Ms. Wilbon, please you give us more insight about you and what you do.
Good morning. Thank you so much for having me, Cheryl, as well as Simone. As you said, I'm a registered nurse, and Rosebud Healthcare itself, my LLC, I am a nurse consultant. I teach CPR. I am a crisis prevention instructor. I'm also child care health consultant. Meaning that if you have a daycare or child care, I can certify you to teach to pass medication because I teach medication administration as well as safety. Now let's jump into my 501c3. That's my heart, Rosebuds Incorporated. Rosebuds Incorporated, we cater to our community. Community is everything. As you said, Ms. Cheryl, you grew up in McRae. I'm from Bachelor, Louisiana, and right. I'm from Bachelor, Louisiana, and I did several food distributions up there. I did one in August and again in December. With that being said, I had community partners. Justice Bra Closet came out with me in December. We also had Sisters in Progress. They came to help out. The Baton Rouge Food Bank was with us both times, but in December, the Federal Reserve came out to issue that food for us. So everything that and not to mention, I was in collaboration with NAACP, Dr. Green, Dr. Whitfield, and Dr. Keller in May before everything opened back up, and we did the first mobile COVID testing here when everyone was afraid. We had our boots on the ground, and we came out for our community to let someone know we are there. Right now, I've also started, I have 2 partners, 2 nurse practitioners, and we just started in February mobile COVID testing, and we're looking to go into mobile vaccination. So to God be the glory.
Yes, to God be the glory. My goodness, thank you so much, Ms. Wilbon. That is awesome. And we want to get straight into some questions because there's so much we want to get from you within this 30 minutes. Well, maybe probably 20 minutes now. But one of the first questions I want to ask you, Ms. Wilbon, during the pandemic, and since we're speaking about disparities in our community, and we have witnessed in racial justice, do you think the disparities within our community and those who are African Americans, do you think with the pandemic and being African American, do you think that the disparities have increased or decreased when those two collaborate?
Well, first of all, let's just talk about healthcare disparities. Healthcare disparity, everybody just throwing the word around, but so healthcare disparity is the difference in care between 2 components, right, or several. So what we're talking about is our minorities versus the majorities. That's the 2 differences we're talking about. And healthcare disparities came from us not having transportation to the doctor, the doctor not being where we need them. Healthcare disparities came from us not having the money to get care for. Healthcare disparities is not having the food or not being able to afford the food that we can. So it's everything that makes the difference, not that we don't want to. And let's think about the education on that piece. We didn't know. We grew up soul food. That's what feeds our soul, right? So we're soulful people. So we're doing things to help with our soul and help us in the advancement of our mind. And also a health disparity is mental and behavior health because we didn't have that piece as well. So we have a stigma. We don't trust the government because of the different things that have happened. Now, I think that they're trying to help us because of that distrust that we had. It's creating a border. It has a wall there, and we're going to need to further educate. The government is going to have to show us they have our good at heart, and once we could get from there, then we could tap into what we need. But we have to start back at ground zero. Make us trust you. Do something so we could trust you. And one of the things that we could do is put people like us in those positions. That's why we're vigilant. That's why we're in the community. That's why we're destined, because we're skilled. We have the heart set. We have the mind, and we want the best for our community.
Wow. Thank you so much. That was some very informative information because, as I began to read, talking about the pandemic and the vaccine, rather, I also read about, one day I was reading that with the statistics, it was showing that more Caucasians were getting treated with the vaccine than African American and other races. And the information you just gave to us, it actually gave insight on proof that happens because we may have lack of transportation, we don't have the resources they may have, and I really thank you for bringing that clarity to that. And Ms. Simone, what do you think? What is your input on that?
My input, absolutely what she said is absolutely true. And it's about trust. The bottom, I think more so than any of those other things, because let me tell you something, we will make a way to get to where we want to get and try to get to where get what we need. the end of the day, I truly believe that the lack of trust. There's so much, no trust when it comes to, we have such a history with vaccines and tests and studies, health studies. We go back to, I want to say, I'm not very on the, but I remember someone mentioned something about some tests they did, I think it was for syphilis, back in the 50s, where Tuskegee experiment, and I think a lot of our trust stems from things like that we were not always kept in the loop about what these studies or what these vaccines would do to us, and it's fear. And I do believe a lot of it is fear, the reason why we're not lining up to get this vaccine. So, but what Ms. Wilbon brought to the light is absolutely true, too. Absolutely true. They have to do something for us to trust them. And as a whole, as a people, that has to happen. And that's not just with the vaccine, with a whole lot of different things.
Wow. Thank you, Ms. Simone. And Ms. Simone, one more thing I want to touch on. When you mentioned that you're going to have, or you already have it in motion right now, the mobile vaccine unit. When you said that, it triggered, now that you're coming from back, you're going to know what I'm talking about. It triggered back to when I grew up in the country. And everybody knows that when you're in the country, it's totally different from the city. You really do not have all the opportunities that a city has. And I can remember when and it's really touching my heart right now, I can remember when I left high school to go to SU, and when I got in my computer class at Southern University, my school did not have computers. And 98% of everybody in my computer classroom was able to touch a computer. I didn't know anything because my country community did not have access to that in our school. So here you are now saying that with this pandemic and with the disparities, I do believe that mobile unit will be an asset as well as an impact for those not even with just, if they have like not even the resource to get the vaccine, but even the location. So please give us some insight on the mobile unit for the vaccine that you all are working with.
Okay, and I want to touch on what you said, not knowing. That's the heart of it all. That's the reason why we have persons of the Caucasian ethnic that's going to nearby states because they don't qualify for it here, and the reason why African Americans here qualify and not getting it. The mobile unit, it also will allow us to touch those that's bedridden, that's not getting the vaccine. I can remember seeing a Facebook post of one of my cousins in Bachelor, and I'm just thinking about it is breaking my heart again, because it was an outbreak. It was an outbreak, and they were scared and hiding it from each other, people that could help. And I think that's one of the reasons why I did the food distribution, because so many people weren't able to go to work. And but back to the vaccinations, yes, it's to get in the heart and the crevices that other people are touching. We have big businesses that, going to the large churches. We have Walmart, CVS, but none of that's going to help if they don't trust. And I believe people like myself and my two partners, Shatilla and Don, we could touch those people. And it's more people like us because they could feel our heart. What comes from the heart touches the heart. And they need to know also that, we've been getting flu vaccines, different vaccines to go to school, and that should be scaling us up to trust the government, because we've been getting that for years, and that's how we need to look at it. It's something we need to get to the next level. So that's how we want people to look at the COVID vaccine. It's something we need to get to the next level. Everybody right now wants some type of normalcy. Well, let's get vaccinated so we can get that normalcy.
Wow. Ms. Simone, let's hear from you, Ms. Simone. Thank you so much, Ms. Wilbon.
I'm just thinking about when she touched on the flu vaccination, and even with that, it's better than what it was in the past. People now are more trusting of the flu vaccination. But let me, my thing when because I do a lot of this, when I think about, you say people not knowing, what do you think, Ms. Wilbon, that could be done as far as outreach? Are we going about it the right way? Because in riding in the car, I'm bombarded by radio commercials talking about vaccination, where you could be tested. I'm bombarded on social media. Everywhere you look, they're encouraging people to get the vaccination. They're encouraging people to get tested. But somewhere in there is a break where it's not getting to people. And I guess it does go back to trust again. It's one of the reasons why. But why do you think with the outreach efforts, do you think, as you spoke about, people like yourself, when I think about people being out, touched and getting outreach, I think about using the same model as the U.S. Census Bureau uses. Get people out and get them go door to door. Even I know that we're supposed to be practicing social distancing and masking up, but I think it can even be carried out even in a safe way. Because during the election, I did a lot of door to door. What I would do is knock on the door and step back, stay masked up. I had my sanitizer, so that can still be done. And I think when you can go out and have people like yourself. And, people know when you come in contact with you, they know when, like you said, your heart is in it, when you are truly of the people and for the people. So they know this. So I'm thinking that that's something that we need to look at as far as outreach. Outreach needs to be done differently because I'm just going to be honest. What's being done now is not reaching who needs to be reached. So we need to look at another way about doing it. And I think, small organizations, people that are the heartbeat and the pulse of the community should be the people that are allocated the funding to do these. These big businesses, the way that they're going about doing it it's not reaching who needs to be reached.
Yeah, and I want to elaborate on that in saying I agree with I also want to incorporate their PCPs and their pastors. Those are the people that reach your heart. Now, if you go to a PCP that you don't trust, shame on you. But the PCPs, and I'm just thinking about my partners, they actually do the work. And people say the difference when they go to them because they're doing the testing, they're getting their wellness checks. They're making sure that, you just don't, if you go for a cold, you don't leave out there with just cough syrup, but you get everything that you haven't gotten the year or 2 years you haven't been there. So, first of all, we need to tap into primary care physicians, because I always throw those initials. Primary care physicians and people in the churches that can really reach the people. And we're doing virtual everything. Get those people lined up, like you say, community partners that they've seen on the front lines and they trust. Show somebody that they actually trust. They don't know Walmart Corporation, they could go get from Walmart. It has to be personal. It just has to be personal.
And, yeah, exactly. I agree. I was thinking the same thing when I was I'm going to give you a primary example of what I thought, and I have nothing against the way that they're going about it. I was at the corner of getting ready to turn, sitting in a light, and on the electronic billboard, they put all these pictures of people. I'm going to give you Mr. College Temple. I took the shot. My nephew was in the car, didn't know even who that was. My thing is, use people that I call like yourself. You believe it or not, people know you when they see you, Vikki. They know you. Put familiar faces familiar to the community. Now, I'm not taking anything away from Mr. Temple, but people that they don't know these people that they're putting out there and saying that they took the shot. I relate more to people that are like me, that I know, that I see day to day in the community, that I know they're out there, they're on the front line with other things. Besides, way before we even dreamed we would have a pandemic. So even with any disparity, any health disparity, not just the pandemic, high blood pressure, colon cancer, pancreatic cancer, diabetes, heart disease. Those are things that are in the African American community. Even within those things, we have disparities of getting tested or getting the correct health care in those areas. So we need to put people, whoever's doing this needs to rethink how they're reaching people. They need to put people out there that people are used to seeing in their own personal communities on the front line for everything else. They need to be on the front line for this also. So I agree with you about that. We just need to rethink and make it personal. It needs to be personal, people that we have personal relationships with.
And not only that, Simone, while we're checking for the vaccine, let's check to see what else they need. Let that be a wellness check. Let's see what else we can do for them. Right now, we have Dr. Antoine Keller with Harson's. He has a cardiovascular study for 60 and over that's giving echoes and EKG for cardiac screenings. There's so much for us, but we need to get the resources and in the crevices so we can get it to the people that need it.
There you go. We got to work better at the delivery. We have to work better with the delivery of these resources. We're not delivering. We're not educating, and education and delivery are the key things in these disparities eliminated. Closing the ranks between us and other minorities and a majority. We have to start doing that.
And now I do want to credit our government as well as our state level government for making it available. That's big in itself. We're just saying that not every time somebody behind the desk, it takes a village to raise the village and get to the next level. And so we appreciate what they did because without them we wouldn't have anything. We understand. We just want to get the word out, a little more personable.
Yes. And ladies, what I want to do is I want to put a plug on there because that thing about trust, and we know everything has to line up with His word to make it happen. I don't care. The spirit and natural does run parallel. And when you say trust, I want to bring it personal because see, I was one of those people who didn't want to trust the vaccine, so I realized I couldn't trust the vaccine, but I had to trust God and the people that He gave permission to do the vaccine. That's my first one why I had to start it. Why do you say this? Why are you going there? Because my mother is dealing with that CC. Why you don't call it all what it is? Well, because I'm not giving no more power than what it had. And with that, we all were stuck by her taking the vaccine. So when she went to her next visit with her tree doctor, I was like, no, he was like, well, she wasn't taking the vaccine. He was in awe that she did it. So now I got to go back and pray even harder. Okay, so now I got to put even more trust in you as I put it in God even more. So long story short, in doing that, now I'm trying to find her a spot to get her in there, okay? Now it took me days. But when God is for you, when you put the trust in the right place, so I'm saying this to those of you out there who are not trusting in what God has allowed. God allowed another facility because my mom had gone there, hadn't been there in months. And because they knew of her underlying health issues, had my mother been vaccinated? Do you hear me? Because there are 2 spots left, and we want to know if she has not taken it, she's welcome to get one of those spots. So with that being said, my mother was vaccinated. So now my next prayer is, God, with all this fear that's out there, okay, now what I want my mother to have no side effects. What I've heard about, what I've figured out, I don't want it, God. Now my trust got to go to another level. So now you got the naysayers still out there, but then I got the other side. Okay, what are you going to hear? I'm going to believe the report of the Lord. Okay? So now I got to think about my mother and not what the negative is about. Because my trust is in God, not in the vaccine, but the resources of the vaccine. My source is God, first of all. So we go to the vaccine place, and as that nurse began to put that needle in my mother's arm, I already knew what I had to do because the power is within us. He is in with us. So what I did in His name, put my hand on her shoulder And I'm saying this to the believers as well as the numbers, because we as believers can have some doubt in us too sometimes. I did. That's why I'm confessing. I laid my hands on my mother's shoulder, her arm, before that shot went in there, and I gave that shot to God. And I tell you the truth to unbelievers, and you know we need to go get this vaccine. My mother didn't have not a one symptom. Things that young people with no underlying health issues had. My mother had none, and she's even had. I had 3 people to call and tell me how they thought their grandmother was going to even pass. She was crying, all the side effects from the second dose. So now here to go the fear again. Oh my goodness! Now my mom got to get a second. Guess what? I rebuked it. I say my mother will not. I took it to God. She will not. So with that trust being said, and as these 2 women just spoke, to your listening audience, put your trust in God, that He allowed man the knowledge, get the vaccine, and let it do what it needs to do, which is to help us.
Cheryl, I also want to elaborate and say that the test, the vaccination was actually in the lab before COVID hit us in 19. However, they didn't have the funding to complete it, so it wasn't just cooked up when this came out. It was already in the lab and being worked on before this. They just had to finish it when they got the funding. So it wasn't an all of a sudden thing. I think that raised some ease for me and me, and we're all alike. So anything that I know, I try to share because I was not okay with it at first either. Let's all be transparent. But the more I learned, so I just encourage everyone to go get vaccinated. If you need me for anything, if you need me to educate anyone, please let me know. We could see what we could do. But it's about protecting each other.
Well, let me say, let me interject this, Cheryl and Vikki. Vikki, with the resources that you have, the knowledge that you have, and you never know who is listening at these podcasts, because once you put something on the internet and all these different platforms, you just never know who's listening. What are some of the things that, in the last few days you've mentioned to me some things that you want to do here and, in our community here in the Baton Rouge area, but also if you can assist, and, like I say, partnerships can come from anywhere globally. What are some of the things that you want to, your needs in order for you to reach the demographic, to reach the people that you want to reach? And again, I know it's the people that are not getting the resources, that are not understanding, they're not educated about what, not just the COVID vaccination and the COVID testing, but other disparities, health disparities that touch our community. What are some of the things that you would like to see happen? And what are some of the things you're willing to join in and collaborate? Because like we always talk about, collaboration and networking and connecting can make the dream work. Teamwork makes the dream work. So, I'm not taking anything away from these big organizations like Walmart, CVS, Walgreens, and so on and so forth, but groups like Rosebud Inc., which I think can bring that personal touch to what we need.
So, I would like to see collaboration with big businesses to the small businesses. We have our name and we've been approved to give the vaccination, but we don't have our hands on the vaccination. We don't have access to it. We're approved, but we actually have to receive it. You have to go through a lottery. Whereas they're giving big businesses, hospitals, pharmacies, they're giving all the inventory of the COVID vaccinations, and we're here, we're screaming, let us help, let us help, let us help.
Wow, that is so true, that is so true. And with that being said, Ms. Wilbon, how can we, the Bible tells us, and it is, I can't apologize for my belief, that charity begins at home. And Ms. Simone mentioned about the billboard and using someone that That's what I did personally. I went and asked people that I knew, had you been vaccinated? That helped. So it does work. Begin to talk to the ones that you know. Get their feedback. And when we have the knowledge of it, let's utilize the resources that we have. Let's not be selfish. Let's share the knowledge. Like the information that I've encountered just this morning, what I've read upon Ms. Vikki Wilbon, and the points Ms. Simone put out there. Guess what? Sheriff's going to share that. Not going to be selfish with it, because like you said, Ms. Simone, we never know who's listening. It could take that one word that could save one life. That one life to save another life and another life. Just like a domino effect to go on and on and on. Because not just like Black Lives Matter, every life matters in this. We're not going to be biased. We're not going to be like some who is all about our race. No, he made us all equal. So guess what? Because some of the other races are not as privileged neither. They want to be in denial, but that's on them. So we want to thank you all for being transparent, for giving us that information. And let's come together. Let's collaborate. All the information that we got, reach out to one another. Say it, woman of God. It takes a village to raise a village. And guess what? It has to start with one. So don't think that, just because it's me. No, know your identity, and then you don't know what to do. I can never forget when God told me, I'm going to allow your pain a purpose to help other people. And I was very reluctant about stepping out. Why? Because nobody wanted to hear about what I had gone through. It wasn't about me. It was about helping somebody else. And the word he gave to me that made me go forward, he said, T.D. Jakes will go to his grave never knowing the lives he touched. I got to say that one more time. T.D. Jakes will go to his grave never knowing the lives he has touched. And saying that, I can think about Mr. Red's radio station. Think about the airwaves, the lives it's touching, because he's putting out these type of broadcasts. Just think about the lives he touched that he would never know whose lives he touched. Okay? So it's in that, let's just be obedient. Let's help one another. Let's come together. Let that voice be heard.
Amen. I agree with you on that 110%. We have to work together. And I think that's another issue. We're so busy. Everybody, and I think about it all the time. If everybody was to come together in one, just in just one location, everybody's trying to do something different. But if we can come to an agreement, come to a table, and work together, that goes back to that inclusion thing. Include everybody in the process of getting back to just a little, normal to what we were pre all of this, and so many other things. Like I said, and I love the idea, Vikki, what you said about when they come and get tested or they come and get their vaccinations. Perfect opportunity to give people a complete health check. We may find someone may come and find out that they're diabetic. There are a lot of people walking around and don't even know that they're diabetic. Hypertension, walking around with their blood pressure extremely high, stroke levels, have no clue. So that's a perfect opportunity not only to prevent them being infected with COVID, but also an opportunity to help them get these screenings that they need.
Right, and
so
I want to encourage everyone to stop spreading negative news. You find, I saw the trending person having Bell palsy, but what about the 100, 1,000 people that have no symptoms? We have to stop putting doubt in stuff too, y'all. We have to encourage what's right. If it's our belief not to do something or it'll hurt us, okay, that's our belief. But we don't have to spread it and put negativity in others. Yeah. So we need to come on one accord with that. We also need to wear our mask hand sanitizer. Continue to do the things that we know that are working. Yeah, some of us we've been affected, and we don't want the next person to be affected. We know what they went through. We know how it feels. So we want to be the next person's neighbor. If you haven't seen them, go check on them. If you know they have COVID, check on them multiple times a day. Do some hot tea and soup and leave it at their door. Be a neighbor. We need to just come together and love one another. When we figure what we needed or what we want, that's what we want to do for the next person. And that's where it's going to start.
Yeah. Just pass it on. Do it and just pass it on. Pass it on. You know, and let me tell you something. It'll catch on. I'm going to give you a prime example. You know, I have a great aunt that's 95 years old, and I'm always doing things for her. But I post about it, not to get glorification for it, but I post about the things that I do and the time that I share with her, because there are so many elderly people that live there alone. You know, there's no interaction, no human interaction, you know, kind of, you know, families going about their lives, and because they're older, they seem to kind of, you know, fall by the wayside. You know, if I go and if I'm getting lunch at least once a week, I get her lunch. When I get my lunch, I go get her lunch. You know, and she'll tell me, you know, you visiting me and coming and sitting out on the step while I'm sitting on the porch, that means the world to her. So that's the same effort, you know. I talk to her at least twice, sometimes 3 times a day. Just pick up the phone. It doesn't take, you don't have to go and be there physically. Pick up the phone and call and say, hey, how you feeling? I say, what you doing? You know, when I call, I say, what you doing, old lady? That's, you know, that's what and I can hear it in her voice. It uplifts her. And a lot of times it's not physical issues. We got to think about, too, there's a mental health side to all of this.
Come on.
Ooh, yes.
And that's why negativity spreads so quickly, because of the mental health. We need to help each other, and by you sharing good things, people, you know, try to switch back to the norm. You know, I can remember having a neighbor and being able to go get sugar. Now most people feel like they need to hide what's going on with the neighbor. No. We need to help each other. Be a shoulder that someone else can lean on.
Yes, and ladies, before we end, I thank you for Simone for bringing up that testimony, and thank you, Ms. Wilbon, for saying that. And guess what? 1 + 1 = 2. Because guess what? When you said what was from the heart, it reached the heart. One of my friends was diagnosed with the COVID, and she wasn't able to go to get out. So I said, when I get off from work, I'm going to hurry up and go grab you some of the ingredients. One of my daughter-in-laws, her sister's a nurse practitioner, and one of the ingredients that use is elderberry. So I said, well, I'm going to go grab you some elderberry, the juice, the tea, and it just went down the road. I had a list. So I rushed out the house when I got up because I wanted to catch the place before they closed. I'm rushing out the house, grabbed my purse and keys, then looked to see, because I'm known for having my wallet out just in case I need to do something in the daytime while, you know, working. And so rushed to the place to get the elderberry from the Whole Foods store, get to the counter, wallet. So here I am. I'm knowing the pain my friend is in. Oh, Lord Jesus, thank you, Father. I'm knowing the pain she's in. I get to the counter, no wallet. And because of what you just said about what's from the heart, God knew I was going with a true heart from my friend. We know what this pandemic can do. And no wallet to pay for it. And I'm like, oh, I said, what time do y'all close? I said, it's going to take me 10 minutes to get back home and 10 minutes back. They would have been closed. One lady in line, the third lady in line, she said, ma'am, I got it. I'll pay for it. All I could do was give God his glory and speak the blessings of the Lord over her life, which I didn't need to do because by her doing it, she was already blessed. But I had to declare it because power of life just lies in our tongue. So, and what you all just said actually happened to me. I went to get her something to help for her COVID. The enemy was so mad, you know, he don't ever want to do anything good because he's a liar, he's a deceiver. But all good things come from the Lord. And that's what happened on that evening, that night. He didn't do anything because guess what? The blood blocked, and he blocked the enemy. She was still able to be helped. And I tell you, she was healed. she was healed. And why I'm saying that is because God helped her through somebody else's heart. He used somebody else. I tried, but he used somebody else. But I was in the right place at the right time, in the right spirit. So, and with that being said, I want to thank you, women of God. I want to thank you, Mr. Reg, for your airways. I just want to thank each and every one of you. Miss Vikki Weiner, we got to have you back also. We got to have you back. Miss Simone, you already know your family. We're all family. Thank again, Shadows for Radio, Rebirth. And again, I just can't say it enough. And with all that being said, myself, with Voices of Virtue, we want to encourage each and every one of you just to always know your identity. Walk in your authority. Stand in integrity. Because of virtue, there's no one to be, and no one to be, nor do a better you. So we want to thank you for tuning in to Voices of Virtue. And Ms. Wilbon, before we close, we want you to tell the public, tell everybody how to get in touch with you.
Thank you, Ms. Cheryl and Simone. Thank you so much. My phone number is 225-229-3254. You can email me at info, at Rosebud Healthcare, ROSEBUDHealthcare.net, N-E-T. I am on Facebook as well as Instagram, Rosebud Healthcare and Training, and Rosebuds Inc. And I just think it's so divine that we grew up in the same rural area, never met each other. And when you said McCray, I could have just, I was like, oh my God, you can't, some divine connections you can't even dream of. They walk through the front door or through the telephone just like you did today. So thank you, Voices of Virtue and Rebirth Radio.
Thank you.
You are welcome.
Ms. Simone, she's just walking in that purpose, all because of her tuning. Thank you. Thank you, Ms. Simone Rebirth. And thank you, Shadows World Radio. And you all have a blessed week. And guess what? We shall be back. We thank you. Share, download, and invite.